Go ahead.
All right, let's get started. Welcome everybody to our webinar. We're going to talk about hormone replacement therapy today. We got a lot of questions about this. This is one of the main services that we provide at Spa 316. As it turns out, we didn't know that it would be, we knew it would be important. We just didn't know it was going to be such an important and popular topic. But as a woman myself, who also does hormone therapy, who I personally do the hormone pellets, I can attest to the fact that it is life-changing. So we're going to talk a little bit about the pellets and hormone therapy in general. I've got some questions that have already been emailed in or Facebooked in. I'll answer those as we get closer to the end. There should be a chat screen on the right side of your screen. If you're joining us today live, you can put questions in there as well, and I'll answer those as we go along, so don't hesitate to ask your questions. So let's get started. What we offer at Spa 316 is bioidentical hormone pellet therapy. It is different from traditional synthetic hormone therapy, which pills, shots, creams, those sorts of things. For several reasons, it's different. When we say bioidentical, it means that it looks just like what circulates in your body naturally when it's broken down in a chemical, chemistry kind of format. It is soy and yam based, so it's all natural occurring products. The company that we use for our pellets guarantees us a less than 4% variance, meaning that from pellet to pellet to pellet, there is less than 4% change in the actual dose. So compounding pharmacies by FDA standards are allowed a 40% variance, meaning that the dose you get compounded today could be 40% different than the dose you get next time. And we just really don't like that. When you're talking about hormones, you know that that's kind of up and down, up and down, up and down if you're getting a 40% variance. So our pellets have less than 4% variance. When I say pellets, that's just what it is. It's a little bitty, teeny, tiny pellet. Women have this done about 3 times a year, on average about every 4 months. Men do it about every 6 months. Now it depends on how active you are. If you're super active, you run every day, you may burn through those faster. If you are pretty sedentary and you sit at a desk all day long, they may last a little longer, but not be quite as effective. We want you to be somewhat active because they are broken down by cardiac output. So you have blood cells that kind of surround the little pellet and break them down, and that's what activates them. And the more your blood is circulating, the more effective that will be. Women, the pellets are inserted into like the fleshy part of your hip, in your buttocks. For men, we do a newer procedure for men because they get a higher dose, obviously more pellets. It goes into their flank area, so kind of mid-lower back and that sort of fat pad back there. The procedure itself takes about 5 minutes. We'll numb you up. That's the worst part. The lidocaine burns and stings. We'll make a very small incision, insert the pellets, put a little steri strip and bandage over that. The bandage stays in place for 3 days. You can shower during that time. You just don't soak in any water. So no hot tubs, bathtubs, pools, that sort of thing for 3 days. After that 3-day mark, you take the bandage off, you live your life. We also encourage you not to do any strenuous lower body activities during that 3-day period. So no squats, lunges, long bike rides, that sort of thing. But regular walk-in activities, those things are all perfectly fine to do during those first few days. Everybody's a little different. I will say the first time I had pellets inserted, let me back up. I had a hysterectomy about a year after my son was born, and he's 8 now, soon to be 9, which is hard to believe. But for those few years after a hysterectomy, I just really didn't feel good. I just felt tired all the time and run down. And so when we started learning about this hormone therapy, I decided to do it for myself. And we don't do anything that we, offer to the public that we wouldn't do for ourselves. And in fact, since I've started doing it, my mom does it, my grandmother does it, it is a safe option. But when I started doing it, within 3 days, I could tell a big difference in the way I felt. I called my mom, and this sounds kind of crazy, but I said, you're gonna think I'm nuts, but the grass is greener, the sky is bluer, it's like this fog lifted, and suddenly I felt good. I will say it's not like an energy pill. You're not taking like a caffeine pill. You're not gonna wake up and feel like running a marathon, but what it does offer is improved sort of stamina and energy throughout the day. So instead of waking up first thing in the morning and feeling like, oh my gosh, how am I going to get through this work day and get my kids to practice and get homework done and get supper done and I can't wait to get back in the bed. I am still tired after all that, after a long day, but I am not just dreading it from the get-go, if that makes any sense. I have much more stamina to get through the day, get stuff done, and have a little energy left at the end of the day. So it's very effective. But like I said, for everybody, it can be a little different. Some people can tell a difference in the first few days. Other people, it takes a couple of weeks. People will sometimes say after their first or second round of insertions, well, I just don't feel like it's working as well as it did the first time. It probably is working just as well. We're just not letting your hormone level get as low as where you started. So you're not getting that dramatic increase like you would have with their first go round. So that change is just a little less dramatic. Welcome to everybody who's just joining us. We're glad you're here. We got started right at 12 o'clock on the dot. So this will be posted later today on our social media and our YouTube page. So if you want to go back and watch the first couple of minutes, but I'll say again, there is a chat box to the right. If you have any questions, throw those in there anytime. I've got several that people sent in ahead of time we're going to get to in a moment. So some people can tell within the first few days. Some people, it's up to a month. When you have your first insertion of hormone pellets, you will come back in a month and have labs repeated and talk with our nursing and providers and make sure that we've kind of hit the nail on the head. One of the big differences between bioidentical pellet therapy and traditional sort of synthetic hormone therapy is this is not a one-size-fits-all kind of dose. It's a very customized dose. So we take your symptoms, you'll do a symptom checklist, and there's a whole long list of symptoms that, believe it or not, hormones impact. You'll take your symptoms, your lab values, your BMI, your medical history, all those things kind of combine to determine what your dose is going to be. So at that 4-week mark after your first insertion, we make sure that we've sort of hit the nail on the head. And if not, then we'll give you a boost, which is included. We'll do all those things to kind of make sure that we get your hormones really optimized. Another difference in this kind of therapy versus sort of the way physicians are traditionally trained for hormone therapy is when we get very little training actually in medical school and residency on hormone therapy. There was a big WHO study done many years ago on progestins, which is a type of synthetic hormone that showed an increased risk of cancer. So we've all just sort of been like, nope, no hormones for anybody. That's sort of the traditional way to go. Both of my grandmothers were on, or have been on sort of synthetic estrogen for probably 50 years. When I came out of medical school and residency, I was like, we've got to get y'all off these hormones. We tried stopping both of them. They both felt horrible. So even early on in my career, I realized that to some extent, hormone therapy is a quality of life issue. Yes, we have to be concerned about safety measures, but it's also about quality of life. And so then when I started learning more about bioidentical pellet therapy, I realized how life-changing this could be, how important it could be. And so I've transitioned myself and most of my other patients to this if possible. The pros of bioidentical pellet therapy over traditional synthetic therapy are pretty vast. It is safer. Bioidentical pellet therapy has not been shown to increase your risk of heart attacks, strokes, blood clots, or cancers like synthetic therapies can. You don't have to remember to take a pill every single day. You get a higher hormone level than can be achieved, and it's also a customizable dose. It's not a one-size-fits-all, so it is something specifically dosed for you. So generally, patients get better symptomatic control, longer symptomatic control. The disadvantages are it's currently not covered by insurance because it is a bioidentical, not necessarily represented by big pharma, and so that unfortunately politically plays a role in things. And it is a procedure. For me, that is a plus. I'd rather have a short little procedure every 3.5, 4 months than have to take a pill every single day. Some people, don't like needles, don't like the idea of a procedure, and so that's considered a con for them. Assuming you don't have any other medical history, we do blood work after that. Like once we kind of we know that we were on the right dose, we know that we're on the path. We do blood work once a year after that just to make sure. Your body chemistry is going to continue to change as you age. We just make sure that we're still kind of on the same in the same ballpark, but it's very symptom driven after that. Once we know we kind of got you on the right dose, it's very symptom driven. I tell patients all the time, you live in that body, you know when something's not right, so you should listen to it. And so we pay very much attention to how we feel and make adjustments from there as needed. So some of the, for women especially, some of the symptoms related to hormone imbalance, of course, excessive belly fat or unexplained weight gain, night sweats, hot flashes, mood swings, all the things we kind of consider menopausal. Anxiety and depression are huge. It's no secret, I have been very honest about my own personal struggles with mental health, and it kind of tends to kind of run in my family and dealing with those sorts of things. I tend to be kind of a type A, OCD, wound up kind of person, if you will. Since starting hormone therapy, get my hormones kind of optimized, I have not had to take anything for anxiety and depression, which is a huge blessing. And that's, for me, the first thing I notice kind of as things start to wear off is I kind of get emotional and moody and things I feel like aren't really kind of me. Low sex drive, poor sleep, low energy, fatigue. Raise your hand if you don't suffer from those things, right? Memory problems, lack of focus. One thing that a lot of women who come in menopause or perimenopause will not necessarily have hot flashes or mood swings, which say, I can't remember anything. I just can't get anything done. I can't focus on anything. And that's actually a symptom of hormone imbalance. And then, of course, fibroids, endometriosis, PMS kind of symptoms, vaginal dryness, all those are related to low hormones in women. Men have a lot of similar symptoms. All of those things plus decreased muscle mass. A lot of guys come in, they say, I still go to the gym, I still work out, I just don't see the same results that I used to. I always joke around and say, you know, women come in because we feel bad. Men come in when their parts don't work like they're supposed to. But by the time a man has erectile dysfunction from low testosterone, he is at the very end of the spectrum. All of these other things have happened, and he's at increased risk for all these other things by the time that occurs. So that's really kind of the end of the line, is when erectile dysfunction occurs in men. Women, you'll agree that you see as your fellas start to age that you notice changes in their mood and their stamina and their desire to do, motivation, all those things. Those are all kind of hormone related for men as well. So again, it's a small procedure for the bioidentical hormones. Men every 6 months, women about every 4 months on average, but everybody's a little different as far as how they process those things. One of the questions that were sent in ahead of time was, do we base our hormone recommendations on normal lab range values only? And the answer to that is no. Normal lab values. Okay, so it's a bell curve, right? And 95% of people will fall within that range. So from the get-go, there's 5% of people that are going to feel better outside that range. Then as you age, from the time you're 17 to the time you're 67, that bell curve is going to change a little bit. A normal testosterone level for a 17-year-old male is a lot different than a normal testosterone level for a 67-year-old male, because again, we're thinking about where do 95% of 67-year-old men's testosterone values lie. So this kind of, we consider those normal ranges, but this is really about hormone optimization. So if normal testosterone level for a male, let's say the average male, we want it to be around 1,000. Traditionally, unless you drop below 200 or 300, doctors aren't going to talk to you about hormone replacement. But we know when your testosterone level is at 200 or 300, you don't feel good. You're tired, low energy, low sex drive, maybe it doesn't work like it's supposed to. All of those things are happening when your testosterone is that low. So we don't really care how old you are. We want you to feel your best. And so our goal is to get you up to a normal testosterone level for a younger man. And the same is true for women. The range of testosterone is, 15 to 50 for women.
That's all that food is at least close by.
But when you're optimizing it, you want your testosterone level between 150 and 250 because that's where it is when you're younger. So it's not a fountain of youth. That's kind of what that sounds like when I answer it like that. It's not a fountain of youth, but it is about optimizing your hormones. Where do I feel the best? And when we get those hormone levels and those optimal ranges, you get better bone health, brain health. It helps kind of ward off memory issues, age and metabolism, muscle mass. All those things are better when we kind of optimize those values. So we consider normal lab ranges, but no, we're not basing our treatment protocols just on that. It's very much symptom driven. We are not just looking at your sex hormones like your estrogen and testosterone. We are also looking at thyroid hormone levels. We're looking at your kidney and liver function, blood sugar, all of the things, vitamin levels, all the things that metabolically could be contributing to your symptoms, and trying to optimize all of those things. Someone emailed a question about creams. Let's see, we got somebody not muted here. I think we got everybody muted now. Sorry about that. Someone emailed a question about hormone creams and how those compare to hormone pellets, because the creams can sometimes be hard to find. So most hormone creams are compounded. You have to find a compounding pharmacy. A lot of doctors will have their own formulas for how they want them compounded. That's all fine and well, and they are very effective for some patients. The biggest issue with creams is that the absorption is variable. So depending on your hydration status or what creams or lotions you may have put on your skin, you may find that it doesn't absorb as well. So again, you're just getting that variability. The pellets, you just kind of get a more consistent range. Another question, can a woman who has had a hysterectomy and both ovaries removed get testosterone replacement along with estrogen replacement? Currently receiving estrogen but no testosterone. Absolutely, and in fact, you probably should, assuming there are no other medical issues that would warrant you not having testosterone. Almost all women, if you come in premenopausal with hormone issues, you're going to get testosterone. It's not really until after menopause, and if you've had both ovaries removed, then you are kind of regardless of your age, sort of in menopause, then yes, testosterone and estrogen would be important. They work together. So it's important to have a good balance of both of those, and you need both. Yes, women need both. It's kind of a misconception that only men get testosterone. Obviously, they need a lot more testosterone than we do, but it's a misconception that only they get testosterone. We need it as well. That's what drives a lot of the metabolism and energy kind of things that happen with hormone imbalance in women is low testosterone. Is there an option for women to get testosterone replacement in another way other than pellets? If so, what would that be? And do you offer this service? So yes, there are options. Going back to the fact that one of the disadvantages of the pellet therapy is it's not covered by insurance. So it's $350 per treatment for women, $750 per treatment for men. We offer a membership program because, again, this is something that you're probably going to do long term because it makes you feel so much better. There is no upper age limit for this either. You can do it long term. It's safe to do long term. But it's not covered by insurance, so that can be cost prohibitive for some patients. So when we talk about, for whatever reason, you can't do pellet therapy, there are shots and there are creams and there are oral troches, which are kind of like a little dissolvable thing. The creams and the troches come from a compounding pharmacy, and those are options. The shots are like what men would get when they are doing testosterone shots. It's just in a much lower dose and a smaller volume. Again, the disadvantage to those things is with the shots, you kind of get this high and low, this up and down. You'll get kind of this peak and then it drops off and it doesn't last super long. The creams and the troches, the variability just in from dose to dose, from refill to refill, and then in absorption as well. So there are options. In my opinion, they're not as good, not as safe, not as effective as the pellet therapy. But there are options and they are available. Can a woman get testosterone pellets and control estrogen with a daily replacement rather than a pellet? Yes, you can. Again, if you're doing the pellets anyway, it's the price covers all of that. No matter what your dose is, it's the same price. So my advice would be, unless there's some reason, and I can't think of what that might be, to do it that way, I would think that doing the pellet estrogen and pellet testosterone would be more effective than doing just testosterone pellets and then adding an oral estrogen, because the oral estrogen is a synthetic, so it does, come with some risks, increased risk of clots. For most patients, those risks are minimal, just being honest. They're not like huge risks. And usually patients have another risk factor: family history, smoker, high cholesterol, obesity, any kind of risk factor for cardiovascular diseases when you're going to fall into that higher risk category for synthetic hormone therapy. Could you do it? Yes. Should you do it? I can't really think of a good reason why you would want to do that, honestly. Can I get information on the cost of pellet therapy replacement, including all required costs? Could labs be done through the medical side or through a doctor's office and filed with insurance and only pay for the pellet insertion procedure to help with cost? You can do that. So our membership is set up to be all-inclusive. It includes labs once a year, plus your insertions for the year, plus all the vitamins and supplements that you'll need for the year. And we'll talk about supplements in just a minute as well. If you were just paying out of pocket, then the labs are $175, and then the pellets $350 for women, $750 for men. Having said that, and it being January, yes, you could go to a medical office, you could have the blood work done, you could file it to your insurance. If you have not met your deductible, and most of us have probably a pretty decent sized deductible, the lab's probably going to send you a bill for about $1,200, because we are checking CBC, CMP, a full thyroid panel, B12, vitamin D, and then your full hormone panel, your testosterone, your estrogen, your FSH. So LabCorp Quest, their just sort of routine bill for those labs is about $1,200. Our cost for running those labs in-house is right at $175. We're basically doing those labs for our cost to try to make it more cost efficient. So you can do it that way, but I just, double check on your deductible, because we've had some patients who want to do that and got a surprise bill and we're upset about it. So we really are trying to pass the cost savings on the lab to get you started for that. Supplements. For patients who do start hormone pellet therapy, there's usually some supplements that are recommended. Because we are evaluating kind of everything. A lot of patients wind up on a thyroid supplement or a thyroid medication. Universally, we recommend, it's called Meta I3C for patients who are doing pellet therapy. It is a specific enzyme that helps break down testosterone and estrogen down the pathways that are safe and don't increase your risk of any of those things. If you don't take it, you don't take it, it's still going to break down. But for men, we will see a bump in their estrogen if they're not taking that Meta. And that tends to make them a little more emotional. So the Meta just kind of helps keep those hormones on the right pathway and helps really optimize the hormones and makes them last a little bit longer. If you're not taking that, you may burn through it, or you may get a little imbalance. Your estrogen may get a little too high, or your testosterone a little too high for women. So the Meta just kind of helps keep levels as they should be. The other thing that most patients wind up taking is vitamin D. We live too far north to get enough sunlight to have normal vitamin D. I cannot tell you the last time that I checked a patient's vitamin D level that it was completely normal. Almost all patients who live in this area have a vitamin D level that's low or on the borderline low level. Vitamin D is critical to your metabolism. It is used in so many body processes for hormone optimization, metabolism optimization, all those kinds of things. So most patients wind up taking the Meta and vitamin D. And then we normally recommend a probiotic. Almost everybody should be taking a probiotic. Even children should be taking a probiotic. Our diet, most Americans' diets are so junky that we really don't we get all the things we need because so many foods are fortified, but we're eating a big processed diet. Most of us are. So the probiotic just kind of helps keep a good gut balance, which is important for everybody. We also tend to overprescribe antibiotics, and people take too many antibiotics, and that can throw things out of balance. So the probiotic, again, helps with gut health. It kind of helps the good bacteria grow more, which will then kind of weed out the bad bacteria, and it minimizes like your risks of GI related illness. So a good probiotic is good. All right, we've got a question in the chat. Since the pellets are customized to each person, any way to keep soy out? Soy is one of my allergens. That's a good question. I'm gonna be honest, I don't know the answer to that. I know the way they are formulated currently, the base for all of them is soy and yam, but I will do a little research into that because I think that it's broken down enough that it should not interact with a soy allergy, as in like you just go eat soybeans. So I guess it would sort of depend on the severity of your allergy. But I'll find out that. That's a good question that I don't honestly know the answer to, if it's possible to keep that out or if it will cause a reaction if you're allergic to soy. So we'll find out about that. Are there any other questions in the chat? Anybody got anything they want to throw out there? I know I'm leaving something off. Again, it's been life-changing for me and for several of my family members. Getting your hormones optimized actually decreases your risk of dementia, osteoporosis, cardiovascular disease. It increases your energy level. People tend to be more active after starting hormone therapy. So the benefits are kind of widespread. You know, when you feel good and you're living your best, it makes a big difference in how you respond to everything that gets thrown at you in life, whether it's anxiety related or whatnot. Thyroid is something that we wind up talking a lot about after we do labs and we're doing hormone consults as well. There are two sort of schools of thought on hormone therapy in the medical community as well. A lot of doctors, if your TSH falls in that normal range, you do not have thyroid disease. Sorry. I tend to be a little more liberal when it comes to treatment of thyroid disorders because, again, it's hormone and it's hormone optimization. So even if you have been diagnosed with low thyroid, sometimes I feel like, you know, we're somewhat undertreated. T3 is what is the active thyroid hormone in your body doing the actual work. So TSH alone is not always enough to just kind of know how things are going. You can have a normal TSH but have your T3 be off. So I think it's important to kind of look at the whole picture, especially when you're initially diagnosing someone. And I would say that if you are already on thyroid medication because of low thyroid and you are still not feeling good or still having symptoms, you probably need an adjustment in your dose. And again, there are lots of doctors, and they're not necessarily wrong, but if that TSH is in a normal range, we're not going to make any adjustments. But sometimes you feel better on the lower end or the higher end of that range, and that's really what we're trying to achieve with hormone optimization. So it's not just estrogen, testosterone, it's also looking at your thyroid and kind of making adjustments there. Dosing for men and women is obviously a little different. Men, we don't ever give estrogen to. They're going to create a little bit of estrogen in their metabolism of the testosterone, and men need a little bit of estrogen, just like women need some testosterone, but it's about finding a good balance as well. Let's see, let me check the chat one more time, see if there are any other questions. Someone did send in another email. How painful is the procedure? I guess that depends on your pain tolerance. I don't think that it's a very painful procedure. The worst part is the shot to numb it up. Again, for women, it kind of goes in the fleshy part of your hip. For men, it's going to go more in the flank area. But we take a syringe and a relatively small gauge needle and we inject lidocaine in that area to numb it up. And if you've never had a shot of lidocaine, it does burn, kind of stings, kind of feels like a bee sting for a few seconds, but then the area is numb, and so you really shouldn't feel anything after that. We'll put the pellets in, and especially men, if you're getting a lot of pellets, they can be sore and bruised, but usually not too bad, and that's easier now that we're putting male pellets up in the flank versus in their hip. So I don't think that the pain from the shot is worth avoiding having an insertion done, if that makes sense. how long does it take them to work? Again, everybody's a little different, but most people within a couple of days to 2 weeks can tell a difference. There will be some things like metabolism as far as weight loss. And I think there was a question also about weight loss somewhere else. Yes, in the long term, hormone pellets can help with weight loss because when your hormones are optimized and your metabolism's optimized and you're feeling better and you're more active, clearly it's going to be easier to lose weight. If your hormones, if you're in full-on menopause or your testosterone level is low, it's going to be an uphill battle to try to lose weight. Having said that, when you first get hormone pellets, you can expect a 3 to 5 pound weight gain, temporary weight gain. Anytime your hormones are changing, you're going to have some water retention. Low salt diet, drinking plenty of water, staying active will kind of combat that during that time. But again, that's just temporary. It goes away after the first few weeks. And then it takes anywhere, if you don't change anything, you don't change anything about your diet or activity level, at 1 year, you will have had some weight loss from starting pellet therapy alone. Not a huge weight loss, but you will have some weight loss. So the majority of benefits, or at least symptomatic relief, happen in a pretty short period of time. But a lot of the long-term benefits happen over a longer period of time. And so it's something that you're going to want to stick with to get those longer-term benefits. And that is, decreasing your risk of lots of long-term illnesses, as well as like the weight loss and the increased metabolism. Those things just take a little more time. It's not sort of an overnight fix with hormone therapy as far as that goes. What happens to pellets after they're inserted? They don't really dissolve. They're digested. So macrophages are a blood type of blood cell in your bloodstream, and they sort of surround those pellets and then chew them away, chomp them away little by little with time. And as they're digesting them, it's becoming an active hormone in your bloodstream, which is another way that they work a little more effectively and more safely than sort of your synthetic hormones, which typically tend to go through your gut. Y'all have any more questions about hormone therapy or Vexapel? I'm going to do a little research on the soy, and we will either email that to you or maybe do a general post on our social media answering some of those questions about hormone replacement therapy. If you came in a little later, I appreciate you joining us. We are going to post this to our social media and our YouTube pages, so you can go back and listen again. And if there are other questions, you can always post them on those pages, and we'll be glad to answer those as well. But I appreciate y'all joining us today. Hopefully I answered a lot of your questions about bioidentical hormone therapy. As a personal testimony, it has been life-changing for me, and I plan to do it long-term just because of the benefit that I've seen in my own life. But it's not for everybody. Not everyone is a good candidate. If you've had certain cancers or histories of clots, then we're going to want your specialist to be involved in that and sort of saying that you are a good candidate. So it is, again, not a one-size-fits-all, but something that we really customize to you and your medical history. But it's been life-changing for me, so I'm a big fan of it for sure, and definitely think it is a safer long-term option compared to some of the synthetic options out there. Thank y'all for joining us today. We look forward to doing this again in several weeks. And if you have more questions, just shoot them to us. You can always email us at info@316healthcare.us as well. And we will see y'all next time. Take care.